BSides DC 2016 videos are brought to you by clearedjobs.net and cybersecjobs.com, tools for your next career move, and Antietam Technologies, focusing on advanced cyber detection, analysis, and mitigation.
Thanks for coming to my talk. My name is Jacob Holcomb. I'm Principal Security Analyst at Independent Security Evaluators, and today I'm going to be talking to you about hospital exploitation, specifically attacking patient health. So really quick, as I said, my name's Jacob Holcomb. I specialize in application and network security. I really love exploit development. Since 2012, I've disclosed approximately 100 vulnerabilities, or I've received 100 CVEs for vulnerabilities that I've publicly disclosed. In total, over my professional security career, I've probably found upwards of about 1,000 bugs. And why do I do this? Because security is incredibly important. So really quick about ISE, we're a hacking company, simply put. We're computer scientists, hackers, and just individuals who like to break things. So that's what we do on a day-to-day basis. Our clients are anybody that is in need of protecting assets. So if you had a critical asset and it needs to be protected from the bad guys, that's what we're here for. And the biggest difference between us and a lot of other security companies is our perspective. We primarily focus on white box assessments as opposed to the black box testing methodology. So really quick, some of the research that we've done in the past is listed on this slide. We've done a lot of work with SOHO routers and network storage systems, and that gave birth to two very popular events today, Soapishly Broken and IoT Village, which you see here. We actually are running the Soapishly Broken CTF contest here at BSides DC, so if you haven't checked it out, you should go do that. Okay, so to kind of get down to business, why hospital security is important. Security in general is very important, but when it comes to hospitals, it's of greater importance because we start talking about the well-being of individuals. And people are obviously in a hospital because they're hurt, sick, whatever. So why this is important is because hospitals are being targeted, medical equipment is being exploited, and patient health must be protected. Otherwise, it's very likely that a patient could die from a cyber attack. So the topics we're going to talk about today are the introduction of my presentation, examine security aspects, and then the recommendation. The examine security aspects will be topics that will be covered throughout the presentation that are basically a recap of the research that we've performed over the past couple of years. So, introduction. I guess the goal of the healthcare research was to demonstrate that an attacker could compromise a patient, the health of a patient. More specifically, we were focused on whether or not it was feasible for an adversary from a remote perspective to be able to induce harm to a patient, as opposed to going after medical records, which is a common vector of attack these days. This research results from our assessment of 12 healthcare facilities, 2 healthcare data facilities, the assessment of 4 medical devices, as well as the assessment of a couple of web-based applications that were EHR to be specific. And then securing patient health, very important. Okay, so for the implementation flaws, we're going to talk about some implementation issues that arise in some of these devices. So they're going to be common application and web application security vulnerabilities. And then we're going to actually dissect a couple of real-world attack scenarios. And these attack scenarios are ways in which remote adversaries are able to break into a hospital and induce patient harm. And these aren't theoretical. We're able to do these throughout our research with the cooperation of hospitals that participated in our study. So that's kind of, I guess, the meat of the presentation. So here are the examined medical devices. I mentioned that there were 4 of them. 2 of them are redacted, as we're currently going through responsible disclosure with the manufacturer. But we have 2 devices listed here from GE, and they happen to be CareScape patient monitors. There's a B650 and a B850. And here is a list of some of the vulnerabilities that were found in the devices. So some pretty common things like the use of outdated software, as well as some common web vulnerabilities like cross-site scripting or cross-site request forgery. And then you have some more serious issues like command injection or memory corruption, which would lead to some form of remote exploit. So vulnerability example number one, we're going to talk about the use of dynamically constructed database queries. So this is really the vulnerability, and the attack that is common with this vulnerability is SQL injection. And SQL injection vulnerabilities are the direct result of an application taking input supplied by a user and then using that in the construction of dynamic queries that are then sent to the database. So it allows an attacker to manipulate, the underlying query structure and, access parts of the database they shouldn't have access to. So as you can see on the slide here, we actually have a web portal, and we're presented with a login page. It's kind of hard for you guys to see, but this is the login page to a monitoring system for a hospital. And this allows you to monitor patient monitors, all the patient monitors that you have deployed, I guess, in a hospital or on a floor, or however your deployment may work. And you can't really read that. So basically what I'm demonstrating here is that we're attempting to log into this portal with the username of Gimpy and some bunk password. And there is some red text at the bottom that says that the password is actually incorrect, so we're unable to log in. On this slide, I'm demonstrating that, again, we're trying to log in, except the username isn't just Gimpy. It's Gimpy and a very, very trivial SQL injection payload. Your common or 1=1 attack, and then just a bunk password. Here is showing the interception of the request going from the client to the web server, and it happens to be in a binary format, which in this particular case was AMF. And you can actually see the highlighted payload, the Gimpy or 1=1 payload. And when that was sent to the server, we're given this magical response that is different than what we saw when we were unable to log in. So that's kind of interesting. Well, as soon as our browser receives this response, we're presented with this lovely page. And we're essentially able to bypass authentication by injecting a very trivial payload. So the very common example of SQL injection that you may have learned about when you were first, curious about what SQL injection is, exists in a medical device that is used, within a hospital. So it kind of shows you the state of security of these devices. It's fairly weak. The next attack example we're going to talk about is insufficient input validation and output sanitization. And this refers to a very common web-based attack known as cross-site scripting. And again, like most vulnerabilities, cross-site scripting results from the application taking raw user input and then using that without properly validating or sanitizing the output. So here, this is a less complex example, just showing the typical JavaScript alert box saying like, hey, medical device, cross-site scripting. This is in the GE CareScape monitor, as you can see, GE Healthcare logo in the top right. And vulnerability example number 3, we're going to discuss the failure to canonicalize file paths. And this results in a directory traversal attack, also known as a .. attack. Again, the result of the application taking input without properly validating it. So here we are showing the GE CareScape, and while we were playing around with this device, we had noticed that there was some functionality to view log files. So we clicked on the View Logs button, as you can see in the left-hand panel, and we were presented with this sub-modules for viewing logs. Well, when we clicked on one of these buttons, we see that the device issues an API request to the server, that the client, our web browser, and there is this GET request to the viewlogfile.cgi file, and there's an HTTP parameter that is passed called link name. And if you notice the value of link name, looks awfully familiar or similar to a file path. And sure enough, var log messages is a directory or is a file that exists on a Linux system. And if you were to request this file, you're going to get the messages file. Well, we can play around with that again and use the .. sequence and just back up a little bit. And then we're going to go back in, to the Etsy directory and access shadow. Well, as you guys know, this attack would succeed if the application was vulnerable to directory traversal and if we had permission to read the shadow file. That's owned by root. Hopefully this doesn't work. Oh, crap, it worked. All right, so there are two serious issues here. One, we've demonstrated that an attacker is able to, or identified and is able to exploit a directory traversal vulnerability, and we've also demonstrated that the web server that is running this vulnerable application is running with root permissions, or at least the code that was accessing that file was privileged. So we were able to read files owned by root. So essentially, any file on the file system, we're able to access through this vulnerable application. The next vulnerability we're going to discuss is the use of outdated software. So in a lot of cases, the severity of this issue could be on opposite ends of the spectrum, right? You could have, I don't know, a simple information disclosure that may be rated as a low severity, or you could have a vulnerability that leads to remote code execution that would be rated as higher critical severity. So when you see this classification of use of outdated software, I guess the end result could be disastrous, or it could be fairly benign. Well, in this case, we're just looking around at the system, and we had noticed some interesting files. And these interesting files made us look at some bugs that have been recently published. And a big one is the shell shock. Quick show of hands, who's familiar with the shell shock or the bash shock bug? Most of you, as you should be. Awesome. So really quick, this bug exists in bash, and it's the result of improper or inadequate parsing of function definitions. So what actually happens is if you have if you have an environment variable, and that environment variable contains a function definition, whether it's correct or not, it just has to be syntactically correct, any trailing characters are going to be interpreted and actually executed. So what you can do is set up an environment variable to contain a bogus function definition, and then have whatever attack string that you want to execute following that definition, and bash will go ahead and incorrectly parse it and execute those commands. That's pretty awesome. So like I said, we're playing around with the device, and again, I mentioned CGI files when we were talking about directory traversal. Here it is again, view logfile.cgi. This is pretty interesting. Given the way that CGI files are handled by, I don't know, certain web servers, maybe or not, maybe or maybe not, will this thing be vulnerable to shell shock? So really quick, knowing that it leverages CGI, knowing of the existence of shell shock, we quickly constructed a payload. And there's a picture of my colleague's terminal here, Jake Thompson. He's actually sitting in the audience over here. So hello, Jake. But as you can see, we're using curl. It actually might be hard for you to see, but we're using curl. And basically, we're going to make a post to this web server. And in the user agent, we have a function definition, which, by the way, the user agent gets set as a specific environment variable in Nix-based OSs. This is part of the reason why this is going to work. So we have our function definition, and then after it, we have a string, an attack string, starting with the word bash. And really what that is running bash in interactive mode. And then if you notice the redirection, we're going to read in from /dev as the input to the bash interactive mode. And the /dev is actually going to make a connection to us, because we're going to use a TCP device to connect back out to us, and then use some input redirection to be able to interact with this shell in interactive mode. So we send this to the server, and fingers crossed, bam, reverse shell. Okay, so we were able to compromise this device without authentication from a remote perspective using a well-known vulnerability. As you can see, we have the shell, who am I root. I'm talking really fast. All right, so now we're going to get into attack anatomies. And yeah, really quick, we have a list of the, not a list, but we have a picture that has a list of locations of various hospitals that were part of our study. So really quick, attack anatomy number one. We're going to basically own a hospital from a remote vantage point, and how are we going to do that? We're going to go in through an external web application. So what are the attack steps here? Well, as a remote adversary wanting to break into a hospital, I need to figure out how to break the perimeter of the hospital first, right? So obviously I need to circumvent the perimeter. Once the perimeter has been circumvented and we're inside the network, we have to pivot within the hospital. And once we are pivoting, we have to compromise an end system, and then we hopefully profit. Okay, so how do you circumvent the perimeter? Well, first you have to identify external endpoints. And in this case, while we were working with the hospital, we were looking at their IP range. We had found an endpoint that was used for, I guess, data collection. I got to be careful with some of the details that I reveal to you guys. So they used this endpoint for data collection. It was exposed without authentication. We figured this would be, a great avenue of attack. So we started messing around with the external web server and the application, and we attempted to identify and obviously exploit vulnerabilities. Well, once doing that, once we owned the web server, we had a system on the network. We essentially were in a privileged location, and from there we had to, I guess, go further into the network. And how do you do that? You're going to have to map internal systems, and then from there you're going to continue to pivot. And that's the exploitation of identified systems. Okay, so as you're pivoting through the network, you need to have, I guess, an end goal in mind. And our end goal was to find and compromise a medical device that would allow us to induce harm to a patient. So here, quickly, is a demo. These demos aren't live demos, but I will talk to you about them as they're going. So could somebody kill a patient from another country? The answer is yes. And what we were able to do is demonstrate that a remote attacker could compromise an external-facing web application using SQL injection vulnerabilities and file inclusion vulnerabilities. I had to redact that from the presentation. Sorry, guys. And then from there, they're able to pivot throughout hospital machines on various network segments. And from there, you compromise a vulnerable medical device, and you can induce harm to a patient. And they may fall over just like that. Maybe, maybe not. So yes, from an external perspective, you can definitely induce harm to a patient, and you profit. The profit is harming your patient. Attack anatomy number 2. Okay, so this is kind of interesting. I just demonstrated, or at least talked about, how it's possible for an attacker from a different country or some remote location, to harm a patient. And this next attack, anatomy, is remote, but it's local, but arguably it's remote. And what I mean by that is we're going to leverage a guest kiosk, and the vantage point is the hospital lobby. So again, as usual, we have to circumvent the perimeter of the hospital network. We have to pivot within the network, and then we have to compromise an end system and profit. The profiting is going to be the harming of a patient. So here is a picture of a hospital, one of the hospitals that we've actually attacked, and there's an arrow pointing to a guest lobby, or a guest kiosk, excuse me. Really quick, this kiosk was used for, I guess, visitor registration. You can go up to it, it's in a kiosk mode, you type in some data, and it will print out a banner or a sticker or whatever you want to call it. Okay, so circumvent the perimeter. Well, we talked about the hospital kiosk. It's in kiosk mode. There's no ability for an attacker to do anything that interface with this kiosk mode. So you think. Well, we start thinking about, I guess, okay, what is this kiosk? Well, it's obviously a computer. We see that there aren't any physical connections, so it's obviously connected to the network over wireless. Okay, well, that's good to know. How might these technologies be implemented? So you kind of start thinking about, I guess, what a kiosk is, what's involved, and how somebody would have implemented it. And a common thing that you find these days are a lot of kiosk modes are actually web applications. So I got to thinking, okay, maybe it's a web client. Well, let's play around. Well, as we're playing around, we had figured out that, oh, hey, there's no Windows key, there's no way to escape out of this mode, but it is a web client. What about right-click? Well, you right-click, sure enough, it's a web page, and you get this awesome dialog box that says, I don't know, view source or view page source. Well, you can click on that, okay? All of a sudden, you get a lovely, developer tool like Window that has all of the source code for the page you're reviewing. That doesn't sound very useful, does it? Not in isolation, but that window also happens to have a save button. Okay, so you go File, Save. What happens? You get this nice little, pop-up dialog, that's allowing you to browse your file system and choose a location to save a file. Something you may not know about Windows is in that little Save dialog, if you navigate to a file and hit Enter, that file is going to open. Well, cmd.exe is a file, isn't it? Yes. So we did exactly that, and this picture shows it. We navigated to cmd.exe, immediately got a command prompt, and behind the command prompt, you can actually see the save dialog that I'm referring to. So awesome, we have a shell. Sweet. What can you do with it? Well, I don't know. Pivot? Yeah, absolutely. So this user, or the user on this machine was actually a domain user, and this kiosk was connected to a privileged Wi-Fi network. So this hospital had a guest network, guest wireless network, excuse me. This wasn't attached to that. Nope. It was attached right to the privileged network. So we immediately had a domain user on the privileged network. From here, we're able to, pivot. So again, just showing you a closer or a zoomed-in picture of the terminal. There are two arrows. The bottom arrow is just showing that, hey, look at kiosk machine. And the second arrow is just pointing to a reflection of me that has my visitor band on. And then the next picture here is from our shell. We're pretty much able to do whatever we want. And I'm just demonstrating that we have the ability to download and execute code. And in this particular example, I'm showing use of the PuTTY client. We downloaded it, executed it, and from there we're able to leverage secure shell to help pivot throughout the network. Yeah, port forwarding is awesome stuff. So from there, compromise a medical device, and you just continue pivoting until you find the individual or device that you're after, and you're going to profit. So, oops, sorry, another demo. So could somebody kill a patient from a hospital lobby? Well, the answer is yes. So just kind of recapping what we did, broke out of the kiosk mode, we got a command prompt. From the command prompt, we were able to download code, and from there pivot throughout the network. Waiting on the video. And then as we pivoted through the network, we identified devices, compromised the devices, and then you're ultimately able to harm a patient. This video is a little different. It's showing actual barcode scanner. So one of the devices we were able to reach was a medical dispenser, or a medicine dispenser. I forget exactly what they call them. But you're able to, ultimately, yes, you'd be able to change the prescription that was administered to a patient. So we've now demonstrated that from a remote vantage point, whether it's across the street, another country, wherever, and from within the hospital, but arguably remote, you're able to, induce harm to patients. So the third attack anatomy is strikingly different than the first two, but it's, I don't know, probably going to result in the same way. I've noticed I said result a lot in this presentation, by the way. Anyway, so attack anatomy number 3, social engineering. Our overview here, or objective here is, instead of cracking the perimeter like we've done in the past two, we're going to crack the healthcare practitioner. How are we going to do that? We're going to exploit the human factor. Ultimately, we're prying on an individual's, I guess, innate ability to trust everybody. Vantage point, who knows? I mean, you could be anywhere. It just really depends on the type of attack that you're trying to carry out. So really quick, social engineering. I'm sure most of you are, but who is not familiar with social engineering? Nice, awesome. Okay, so really quick, social engineering. The use of deception to manipulate individuals. So that's kind of a politically correct way to put it. But in other words, you're lying to people to get them to do what you want. So, okay, how did this attack work? Well, we decided to actually leverage USB devices as opposed to a phishing campaign. Yeah, that's pretty much the main avenue for social engineering. So we prepared malware-infected USB sticks, and we delivered the sticks to the hospital and dropped them off in various locations. We waited for infection, and then you profit. So preparing malware-infected USB sticks. Here is a picture of one of the USB devices that we actually used. They happen to be rubber duckies. Are you guys familiar with rubber duckies? Yes? Cool. Rubber duckies, really quick. That's a tool developed by Hack5. It's an HID device to where there is a ducky scripting language, which is ultimately a way to interface with their devices. And yeah. Delivering the malware USB sticks. So once we prepare these sticks, how did we infect the hospital? Well, we pretty much walked in the hospital just like we did when we accessed the lobby, and we just dropped them off in any location that we could access. So anywhere from a nurse's station, a front desk, cafeteria, you name it. Any area we were able to access, we dropped them off, and we dropped about 20 devices off. So now we have to wait. This is the boring part, but it always ends with smiley faces. So you're right. Somebody else may be smiling, but yeah. So we keep waiting, wait, and all of a sudden, ding, we caught our first fish. So within 24 hours, somebody had plugged in a drive, and it's ultimately game over. Wow, what just happened? Okay, so another demo for you. So could a USB flash drive kill a patient? The short answer, yes. So as I said, we prepared these malicious USB sticks. We dropped them off in various locations in the hospital. Some unsuspecting users picked these flash drives up, and in some cases, plugged them in one or more times. And from there, it's exactly as I said. Once they plug in that drive, we have access to a machine, pivot through the network, you find a medical device or the patient you're after, and it's game over. And I'm sorry to say, but score bad guys 3, score hospital 0. Or -3, I guess. So yeah, you profit. Okay, examined security aspects. Now we're going to talk about the human factor. This is interesting. So I just talked about the social engineering attack anatomy and how you can leverage a malicious flash drive to compromise a hospital and ultimately induce harm to a patient. Now we're going to actually talk about a more benign payload that was leveraged in these devices, and this was used for data aggregation. So basically, we conducted a separate USB experiment. We wanted to know how many people would plug these devices in and what types of individuals. And when I say what types of individuals, I'm referring specifically to their role within the hospital. Would it just be, healthcare practitioners such as nurses or doctors, or will we start seeing help desk and maybe higher level technical engineers plugging these devices in as well? These flash drives consisted of a PowerShell payload. This was the meat of, I guess, the attack. And it required a logging server, which I wrote in PHP, just essentially a very small, concise server that leverages a couple of API calls to log data. And we're going to gather information about the victim, the IP address, the username, computer name, and device ID. So here's a picture of the flash drives of a rubber ducky. Those beautiful HIE devices. They're so much fun. Here's the attack payload that was used. Very hard for you guys to read. I apologize. But it's just a ducky script. What's important is the highlighted part here, which you may or may not be able to read. But really all that we're doing here is invoking an instance of the PowerShell web client class and then calling the download string method on that object. And what that's going to do is just issue a web request, and it's going to call my API with the data that we gathered. And here is the table of results. So in this table, it's hard for you guys to read. We caught several fish. We had several nurses plug in these devices. We've had network engineers plug in these devices. So some of their core administrators that we actually worked with throughout the course of our research, they plugged in these devices, as well as some hospital executives. So we pretty much compromised all layers of a hospital. Pretty much any department you would want to have access to, we definitely gained access to it. Yeah, the Lenovo PCs, Yep. Division of responsibilities. So this is kind of a unique thing in that not every hospital has this predicament. But while we were working with some of the engineers in the hospital, they've actually oftentimes were heavily distracted doing, I don't want to call it meaningless, but less important tasks, such as resetting a user's password. So you have individuals who are combating malware-infected machines who are then interrupted to go and reset, Joe Schmo's password. So there's definitely a discrepancy between what is the responsibility and whose role is responsible for the responsibility. Okay, so examine security aspects. We had the use of outdated software, systems with known malware infections, missing or unenforced security policies, undocumented systems, and unregulated vendors. All of which led to disastrous things that we'll talk about. So the use of outdated software. Within the hospital, we found a large number of Windows XP machines, as well as Windows Server 2003. We all know that Server 2003 and XP are no longer supported. And pretty much, lots of servers and workstations were missing security patches. That's a very polite way to say it. So really quick, I mentioned Windows XP Server 2003. That's pretty terrible. As attackers, we get really happy when we see those types of things. This has nothing to do with the hospital, but you could arguably make a point that maybe hospitals are a little more secure than, other industries such as airlines. I was boarding an aircraft and happened to notice a Windows 98 computer booting up. Yeah, that's reassuring, knowing that the 747 that I'm flying on is, operating on Windows 98. It's pretty cool. So if that's not frightening, I honestly don't know what is. I mentioned systems with known malware infections. So I have a screenshot here that's actually showing an antivirus engine, and it detected some web-based exploit, and there are quite a few files that are infected according to the AV engine. Well, this is a hospital computer. More importantly, this is a computer that's actually running a pharmacy within a hospital, and it has no malware infection. I also think the people responsible for running this machine are avid shoppers, as they have multiple instances of couponprinterservice.exe running and listening on various network ports. They just must be looking for some great deals. I don't know. Or maybe they're just handing out free shells to everybody. Either way, it's no bueno. Okay, so missing and unenforced security policy. Hospitals appear to have very little, secure computing policies. There really isn't a whole lot of, training that goes into informing staff what they should and shouldn't do on a computer. An example would be every individual that picked up and plugged in one of our flash drives. There obviously haven't been clearly instructed on common social engineering techniques. A lot of this stuff is exemplified by earlier topics of discussion. The use of outdated software. If you have a bunch of systems that are running outdated software, you probably don't have a policy that is for patching your systems. Systems with no malware infections. Again, if you are aware of a system with a malware infection, you should have some protocol for handling said system. If they're just running rampant on your network and you're not really doing anything to remove them from your network, it's indicative of a lacking or absent policy. And then I already mentioned the using untrusted peripherals, but that's a really big one. Don't plug in flash drives you find on the ground. I don't know what else to say. So undocumented systems. This is great. So we're actually in the hospital. We were performing a port scan. We identified some outdated, I believe it was like Debian 6 or something, some really old machine, and we actually inquired with the hospital, one of their engineers, and we asked them, what was the purpose of this machine and where was it located? Well, unfortunately, they didn't know the answer to either of those questions. So this is exactly what happened. They couldn't find the machine, so they had to literally trace Ethernet cables from their server room to patch panels to the room where the server ultimately resided. Funny stuff. So unregulated vendors. What do I mean by that? Well, something I didn't know until I actually got into, hospital security, I'll call it, was that within a hospital network, there are several different departments. An example I'll use is the pharmacy. The pharmacy from the hospitals that we looked at, wasn't directly affiliated with the hospital. They're kind of like a contractor, so to speak. So what happens is these external contractors, I'll call them, comes into the hospital. The hospital engineering team kind of sets them up with an environment to deploy their computer systems, and then they're left unchecked. So to a degree, you could think of the hospital acting as an ISP. But what ends up happening is that the vendors end up dictating to the hospital engineers how the network should be architected, what types of systems and data should be permitted through the firewall or through other network segments. And it ends up leading to a very insecure environment for the hospital as a whole. And I guess what happens next, what am I trying to say? The security issues. Okay, so yeah, with these environments, that are deployed by vendors, excuse me, I lost my train of thought. These vendors deploy these environments. The hospital takes a very hands-off approach. Once it's up and running, they don't question anything. And because of that, the systems that reside on these networks end up becoming, I guess, subject to attack, and in some cases compromised, as I demonstrated with the malware infections, and the IT staff just ignores them. Their hands-off approach is not their problem. So what do we do to kind of address these issues? Emphasis needs to be put on the fact that patient health is more important than patient health records. Okay, so that's a big thing. In a lot of cases today, you'll hear hospitals or manufacturers of medical devices talking about HIPAA and other compliance standards that I guess are their core focus. Well, I can tell you in most cases, none of these standards state that the health or the well-being of an individual is a concern. They're more or less concerned with the confidentiality of data talking about the patient, right? So the health of the patient is irrelevant. The information about a patient's health is relevant. So there kind of needs to be like a paradigm shift as to what is the focus or what should be the focus of security. Hospital IT, they need to take control of their networks from device vendors. It should really be the opposite way around, or the reciprocal of what I said. Can somebody tell me when was the last time you dictated to your ISP, what your bill should be, or how much bandwidth you should have? It's probably never happened. And in this case, vendors shouldn't be dictating to hospital IT staff how their network should be ran and operated. Threat modeling. Threat modeling is very important. Ultimately, there we go with the ultimately. It allows you to quantify the risk. Quantify the risk posed to an organization by identifying all the possible threat actors, your assets, and vulnerabilities. With a proper threat model, you're not going to prevent the ability to, I guess, you're not going to be invulnerable to attack, but you're definitely going to limit the damages should you be attacked and actually compromised. And then finally, FDA regulations are way too strict. Hardware and software certification specifically. So medical devices, they have to be certified. And once they're certified, if any change is made to the device, that entire certification process has to be gone through again. And that's very costly to manufacturers. So oftentimes they decide to ignore security issues or ignore other types of issues unless they're forced to address them. Hold on one second. And yeah, that's pretty much my presentation. Thank you guys. I appreciate it. And I spoke incredibly fast, so we have more time for Q&A than I had expected. So I guess that's a positive thing or a negative thing. So yeah, I guess I'll open up the floor to questions.
Can you go back one slide, please?
One slide.
Okay. I was talking to somebody at DEF CON who says she's with the FDA who says that the bottom bullet is actually a misconception that's not actually true. Maybe it was at one time, and maybe she was just BSing me. But ultimately, can we source that it really is, that where if you put a patch or a software update or a firmware update, then you really trash the whole certification of the device?
Yes, so the specifics of the certification process I'm not intimately familiar with, but I do know that there...
She was, that's why I'm
Yeah, right. So I know that there is a clause that certain changes are permitted without the device having to go through a recertification. But if you were to address let's say, one of those web vulnerabilities that I had discussed earlier in the software, and it produced a new firmware file, I'm pretty sure you're going to have to go through that certification process again. What? Yeah, right. Yeah.
That same certification process and the length of it, along with the cost, is why you're still finding Windows 98 on medical devices today.
Right. Yeah. Case in point.
The new cybersecurity certification stands for FDA. I read an article about 2 new info phones being the first devices approved on the new process.
I have not.
The FDA just put new standards in place.
No, interesting. Yeah. No, I'm not familiar with that. If you have more information on that, I'd actually like to talk to you about it. So.
Are you familiar with Jay Radcliffe and the work that he does these days?
I am not now.
Okay, you might want to look up IamTheCavalry.com.
Yep.
And,
I do know I am the Calvary.
oh, okay. Well,
Yeah.
Jay's affiliated with that.
Okay.
If you can't find Jay, then find John Foreman.
Yep.
You'll get a wealth of information.
Okay, cool. Thanks for the tip. Appreciate it. Any other questions? Yes? Can you repeat your question?
So, like, when you talk about vendors, how they set up their own network, are you talking about, like, vendors like Starbucks and Panera that inside of hospitals, they actually get connections from the hospital itself?
Yes. So they would be one of the vendors. And actually, I forgot to mention that in this talk. But I mentioned no malware infections. There was one hospital that had a Starbucks in it, as well as some other, I guess, food, whatever. And they had a cash register that went down. The cash register actually had a bunch of database errors, and one of the engineers received a phone call from an ISP, actually, and somebody was actually being DDoSed by this hospital. And the hospital found out that they were compromised because somebody called them and told them, hey, you're attacking me, quit DDoSing me. So their solution to the problem was to just block the outgoing ports of that machine, and they didn't touch the machine. I mean, forget that you have malware running rampant on your network, you know. So to answer your question, yes. Yeah.
So one of those videos, two of those videos seem to suggest that hospitals have, some hospitals have actually set it up to control medicine drip rates for devices.
Yeah. So really, most medical devices, and I'm going to make a point here. So most medical devices these days, they're IP enabled. They have the ability to be controlled over a network. So to your point, yes, it's definitely true. Now the devices that we looked at were passive devices, meaning that they were monitors. They didn't actively, administer medications, other than that one medicine like dispenser thing I talked about. So yeah, to your question, yes, there are machines such as insulin pumps and other X-ray machines that are controlled over the network. You could definitely, actively harm somebody. The devices that we looked at being passive, we would, I guess, manipulate the type of information that was reported to a nurse, and the wrong type of medication, would be administered. But yeah, any medical device you can think of, it's IP enabled. Any other questions over here? Yes? I have no idea. I still don't think they know what it was being used for, but at least they found it. Yeah. Oh, that's what it was. It ended up being a vendor. Yeah. So okay, that's why. Okay.
So for the FDA certification process, how much time, relatively speaking, is spent on safety and efficacy versus security?
Oh man, I don't think any time is spent on security. That's just my opinion. I can't say that definitively, but I would say little to no effort at all. Any other questions? Yes? Oh, we're definitely going to see more of it. So, like, a couple of years ago, Soho routers have been known to be vulnerable for a long time, right? A couple of years ago, I had talked about them being incredibly vulnerable. So have many other researchers. And what ended up happening is we started seeing, malware targeting these devices. There was the Moonworm. The Moonworm compromised a bunch of Linksys routers. They were using a botnet. We recently saw this, botnet that was made up of DVRs and a bunch of cameras. This is in the news like as of yesterday. So to your question, yes, these devices are going to continue to be compromised. Hospitals are going to continue to be targeted. And in a lot of cases, I feel like it's actually going to get worse as the focus has been currently on getting into a hospital or compromising the health records of a patient, but not actually killing people. Like, we haven't actually seen in a real world somebody compromise a hospital in an attempt to kill somebody. You know, when that happens, I think people are going to have a rude awakening, you know, that this is an issue that needs to be addressed. So, yeah, I definitely think this is going to continue to happen. So, any other questions? Yes?
I was just going to say, I used to do FDA evaluation work a long time ago.
Yeah.
So it'll typically be a 4-month to 12-month process.
Right.
It's all documentation. About one of the 14 or 15 areas has to do with security, the rest of it doesn't. So it's all about creating repeatable behavior.
Right.
So that you can say, if there's a recall, you know, what happened and why did we miss it? So it's all about looking backwards. It's not at all about security. But it's such a long and expensive process. That's why they are very hesitant to jump.
Yeah, I knew it was a multi-month process. I thought it was closer to like a 6-month window, but you said 4 to 12. That's, wow. Yeah.
Could they just go a long way by doing proper network segmentation?
So in a lot of cases, network segmentation would reduce the impact of an attack, right? It doesn't make you invulnerable. You can make a lot of these systems inaccessible to an attacker. But again, all it would take was somebody to plug a flash drive into a network segment, you know, that has a vulnerable device, and from there it's game over.
A lot of these vendors and what we saw on TV or things like that.
Any other questions? Yes?
Certain parts of the hospital network, like security access, like for street, like say for ER or ICU.
Yeah, it's definitely going to depend on the hospital, right? Not every hospital is architected in the same way. And what I mean by architected, I mean the network and the servers. But yeah, it's going to depend on the hospital. But really, what we had found that there wasn't a single hospital that we evaluated that did any type of cross-network didn't have any type of cross-network access control. So once you were on the internal network, even though things were properly subnetted, you could just pivot between the networks freely. So, any other questions? No? Well, thank you guys for coming to my talk. I appreciate it.